I had a chondroplasty with PRP injections. I developed osteoarthritis in my right knee and seeking alternatives to allow me to be able to run again. So this was the best option. I walked into a cupboard. I've known him for many years. Met him, I think, first in 2006. I broke a toe. So he was the doctor that was recommended at Nairobi Women's at the time. And he's just, he'll always give you good alternatives as opposed to putting me in a cast. He asked that I go in for minor surgery. He puts a pin, and the healing process was great. And thereafter, I constantly come back to him when I have ortho issues. It was all right. I have an insurance package, so I guess I'm an ortho's best friend type thing. I have a lot of I tear my ligaments, and so I use him a lot. But because he wasn't on our panel, when I walked into the cupboard, I had to use a doctor on our panel who missed a critical part of the X-ray, thus developing the arthritis. So of course for me it was not easy imagining that I'd have to have surgery, because it means that I'd be out of commission for a long time in terms of not being able to run. But he was very patient with me. He allowed me to seek alternatives, take the supplements. I used some other like aromatherapy type of oils. I did physio. And when all that didn't work, he was like, okay, well, now we need to go and do this if you want to go and run again. So that for me was the motivation. And so he was great. Still early days for me. It's 5 weeks since I had the surgery and the procedure, so I'm still limping a little bit. I'm not running yet. So I've healed fast, I think, in terms of I had the procedure. I was in hospital for 2 nights, I think, 2 nights. I was back at work in 5 days. So pretty good, I think, So the proof will be when I start running again, when I'm able to do the things that I love to do. But I cater as well, and on Friday I was able to stand for 20 hours and I'm not in a lot of pain. I didn't have to take any painkillers. I expected it to be really bad, but I'm okay. So I think given time it will settle and I'll be able to do what I love to do. Surgery experience was great. I mean, you always expect that you'll be in a lot of pain, you'll always expect the worst, but it was good. I wasn't in a lot of pain. Meds were great. I mean, the only thing for me that was tough after the surgery was the constipation, which has nothing to do with the knee operation. But overall, I think I've healed extremely fast. Yeah. I've had no challenges in terms of, I guess in terms of, I live in a house that is a multi-level house. So if you want to go down to watch, you need to go down to the living room to watch TV. You need to go up to the toilet. You need to go up to my bedroom. So I've been able to do that. Maybe not as much as I'd want. I mean, like when I came home from the hospital, I was like, oh, just want to be on the sofa, watch some TV. That was uncomfortable because you need to be on a flat surface, and so once you just listen to your body, and I rested, He was at the end of a text. He constantly was checking on me. What's the level of pain? I'm like, none. What's the level of pain? None. You know, so it generally good experience, I think, yeah. I have recommended him to not only my family, all my running friends, my neighbor just came to see me on Saturday, and she was like, oh, you know, when you go and see him on Monday, tell him that I'm going to come for the same procedure. So yeah, I've recommended him.